The latest HSE data on work-related musculoskeletal disorders, or MSDs, for 2024 to 2025 showed these conditions continue to be one of the most common causes of work-related ill health across Great Britain. According to the HSE, an estimated 511,000 workers were affected by work-related MSDs in the last year. This includes both new and long-standing cases. Of these, 173,000 were new cases, meaning thousands of people developed a new injury or condition directly linked to their work during 2024-2025. The impact on the workplace is significant. The latest data shows that 7.1 million working days were lost in last year because of these disorders. This includes both time off for pain, restricted movement, medical appointments, and recovery, affecting not only individual workers but also the productivity and workplace continuity. Looking at the longer-term trend, MSDs had been gradually declining before the coronavirus pandemic. The latest 3 years of data shows that rates similar to those seen in 2018-2019, suggesting that the earlier downward trend has leveled off rather than continue to fall. The same pattern has reflected in the number of working days lost. Before the pandemic, there was a general downward trend, but in recent years, we have returned to the same levels recorded before COVID-19 rather than improving further. The HSE has also identified which parts of the body are most commonly affected. In 2024-25, 43% of cases involved the back, around 221,000 workers. 41% involved the upper limbs or neck, around 211,000 workers. And finally, 15% involved the lower limbs, around 78,000 workers. These figures highlight the ongoing importance of manual handling training, ergonomic assessments, and safe systems of work, especially in roles involving lifting, repetitive tasks, awkward postures, or prolonged physical effort. Certain industries also experience higher than average rates of work-related MSDs. These include administration and support services, transport and storage, and construction. These sectors often involve a combination of physical work, manual handling, repetitive actions, or work environments where ergonomics can be challenging. Finally, the long-term graph of MSD rates per 100,000 workers shows how prevalence has changed over the last 2 decades. Despite fluctuations and the impact of the pandemic years, the overall trend no longer shows a steady improvement as seen before. These stats underline why MSD health must remain a priority for employers. Investing in risk assessments, staff training, equipment, and ergonomic improvements can prevent injuries, reduce sickness absence, and support a healthier and more productive workforce.